Well, Tennessee ranks among the least healthy states. This from a new study from Forbes. Nearly 85,000 Tennesseans died in 2022. Those are the most recent numbers we do have. In Knox County alone, there were almost 6,000 deaths that year. So what's killing East Tennessee? 10 News anchor Sam Perez pulled data from organizations at the state and local levels. And Sam, you took those numbers to the experts.
I did, Robin. I compiled statistics to learn what we are most likely to die from here in Tennessee. And I met with experts to find out what's being done to prevent those deaths. That search started at the Knox County Forensic Center.
Many people come here to die.
In Tennessee's third largest city, with a level 1 trauma center, Chris Thomas sees death in Knoxville every day.
My name is Chris Thomas, and I'm the Chief Administrative Officer and Director for the Knox County Regional Forensic Center.
His team investigates all sudden, unnatural, unexpected, or unattended deaths in Knox and Anderson counties and conducts autopsies for 23 counties. So, what's killing East Tennessee? The Tennessee Department of Health tracks each death across the state by county. Based on the most recent data from 2022, heart disease is killing the most people in Knox County, followed by malignant neoplasms or cancer, accidents, COVID-19, and chronic lower respiratory diseases. Those causes are similarly reflected across East Tennessee.
There are 5 manners of death. Obviously, natural deaths is what most people pass away from.
The Forensic Center isn't always called to investigate, especially for natural causes. These numbers show just the deaths the center worked on, but Thomas says natural causes kill the most people every year.
I think when it's the #1 killer across the U.S., it means that someone has been touched by this disease or this cause of death.
As the American Heart Association's Community Impact Director in Knox County, Nicole Gross sees how heart disease affects people every day.
We're not unique being in the South, and even across the country, we see that there are alarming rates of blood pressure not being controlled, diabetes impacting our elders as well as our young kids.
Cardiac problems aren't the only natural killer.
Obviously, cancer is a large population.
It's the #2 cause of death in Tennessee. Cancer in general is, yes. My name is Dr. Sean Jordan. I'm the Chief of Thoracic Surgery at University of Tennessee Medical Center.
Dr. Jordan works with the most common cancer in Tennessee, lung cancer.
I think it's because we smoke a lot here, basically, is the short version.
Dr. Jordan says early detection is key, which can be accomplished through screening.
The problem with lung cancer screening right now is that it's very underutilized, both in Tennessee and nationally.
While healthcare professionals like Dr. Jordan might be experts when it comes to natural deaths from killers like cancer, Thomas is an expert in the third most deadly category of deaths: accidental.
I can tell you, as far as any death in Knox County that's not natural, we know about it.
In 2023, 905 people in Knox County died by accident. Thomas says the most common accidental cause of death in East Tennessee is drug overdoses.
Those have been on the rise for the last several years.
It kind of has become very much a part of our community and every community across the country.
As the executive director of Metro Drug Coalition, Webster Bailey sees people suffer from substance use disorder.
When I first entered the recovery process, for me, the opioid epidemic wasn't really thought about as an epidemic. It was becoming that. It was kind of on its way there.
In 2024, the Knox County District Attorney's Office reports 297 suspected overdose deaths. While the number is staggering, Thomas says that's fewer than previous years. While drug overdoses are going down, Thomas says instances of another killer are rising.
Just the amount of unsafe driving in general that's going on, that seems to continue to be an emerging trend.
Motor vehicle accidents are the second most common accidental death in Knox County, Thomas explains.
Knowing what people die from is extremely important because prevention, first of all, starts with understanding where you're at from a baseline. You have to know where the problem is to be able to start working through organizations and groups to find out how to combat the curve.
It's a message each expert echoes as they try to cut down on deaths. From eating healthy and exercising more to preventative screenings, seeking recovery resources, or slowing down on the roads, Thomas says there are steps everyone can take when it comes to preventing certain killers.
Education, it all starts with education.
For more information on what experts recommend and a deeper dive into these statistics, you can visit this article on our website and watch the full extended story on our free streaming platform, WBIR+. It's available on Roku, Amazon Fire, and Apple TV. Back to you.
It is enlightening for sure. Sam, thank you for sharing that.